this month, you and several others on this committee joined me in sending a letter to pharma about two studies that reveal troubling increases in drug prices. The study showed that in January alone, 1 month, manufacturers raised prices for 16 of the 20 top-selling Medicare Part D drugs and increased prices for brand name drugs by an average of over 5%. Now, in their response to our letter, pharma revealed that there is no rationale other than industry price gouging for raising prices. And I'd like to share some of what we've learned in evaluating pharma's weak attempts to justify these price increases. First, pharma claimed that drug manufacturers weren't increasing prices at all, that backdoor rebates and discounts have caused the average prices of medicines to actually decline. But they pretty carefully cherry-picked the data on this. In fact, according to the Congressional Budget Office, quote, brand name drugs have experienced substantial growth in average prices. Dr. Conti, what do you think about pharma's claim that prices are secretly declining?
Thank you. It's fiction. Pharma sets the prices of their products, and we are seeing over and over again that the prices of particularly specialty drugs have increased both overall, but also for specific consumers at the pharmacy counter.
Thank you, Dr. Conti. You know, I think the data are clear on this. Brand name drug prices are rising, not falling, and it is absurd to claim otherwise. So let's go to their second argument. Next, pharma claimed that their price increases weren't really hurting consumers at the pharmacy counter. Ms. Stern, you represent patients who are forced to pay high drug prices. What do you make of pharma's argument that increases in list prices don't actually hurt consumers?
I would say right off the bat that does not reflect the lived experiences of people with MS and seniors and people with chronic health conditions across the country who are telling us that they cannot afford their drugs, that they are going off of their drugs, they're skipping doses. And we do hear, I think I've shown that the MS medications have gone up exponentially and that the patients are paying a percentage of that cost and their coinsurance. But it's not just our medications. A lot of medications are going up dramatically. And it's like you said, you can, kind of cherry pick those statistics, but that doesn't mean that people aren't faced with the choice of, buying their groceries or taking their medication.
Okay, so prices are going up and people are feeling it when they go to fill a prescription. Let's take a look at pharma's third argument. Pharma blamed everyone but themselves for higher prices. They claim that middlemen like pharmacy benefit managers, pharmacies, insurance companies were more to blame than the manufacturers. And look, don't get me wrong, I know there are some serious problems with the middlemen, but none of those problems absolves Big Pharma for their part in the price increases. So, Dr. Conti, when you think about brand name drugs, especially the very expensive ones, is it fair to say that brand name drug manufacturers collect more revenue from drug sales and have higher profit margins than the middlemen that pharma is trying to blame for the price increases?
Yes, absolutely. Research shows that the industry itself is benefiting off of the high list prices that they're setting and the year-over-year price inflation that they are experiencing on these products. The only way that the PBMs are enriched by that is if there's competition in these markets. There is no competition in these markets, and therefore there's no rebates, and therefore the PBMs aren't benefiting. It is the companies themselves that are benefiting from the high prices and price increases that they're setting. The company's own documents support this claim.
Thank you, and I appreciate your analysis of the data here. You know, what we have happening in the drug industry is exactly what's happening throughout the economy. Big drug manufacturers have outsized market power, and they face little or no competition for their brand name drugs. So basically, they're free to increase prices exactly as much as they want to. That hurts patients, it drives up inflation, and it needs to stop. And that's why we need to pass legislation that lets Medicare negotiate for lower prices and cut costs for beneficiaries. And it's why the administration also needs to use its existing authorities, such as compulsory licensing and march-in rights, to rein in drug prices immediately. We know what the solutions are. We just need to put them in place, get it done. Thank you. Thank you, Mr. Chairman.